It is my great pleasure to introduce my good friend, Dr. Liza Leal.
Well, hello, Mike. Happy New Year. It is exciting to be in 2021.
Oh, it really is. It was a great, did you have a good New Year and good holiday?
It was nice, quiet, and I really enjoyed that because the one thing I wanted for Christmas that I wanted all year was actually to take a nap, and I got to take a nap. So I know other healthcare workers out there felt the same way. We just wanted to have a few moments of rest and stay away from the ring of the phones and the text of the phone. So it was really nice to have that.
No kidding. Holidays just don't seem to count for you, does it?
No, we signed up for that very early in life, 24/7. That's what we do.
There you go.
But I enjoyed my 3 hours of a half a day to be able to just have some quiet. It was very nice. So I appreciate that.
I know we could see that you're pretty beat up at the end of the year. But Doc, you and everybody else in your entire profession have talked for years about stress and the toll it takes on your body. And I know firsthand all about that because of all the things I have you can tie back to stress. But this COVID mess, it makes people really stressing out, or just anxiety. They're stressing out more than usual. Some of them are barely managing. They're just hanging on there, and some have really suffered. Mm-hmm. I've heard the phrase, I'm sick and tired of being sick and tired, more than once. Can you describe how stress and anxiety really affect our bodies, and what the heck is chronic stress?
Chronic stress is a really big topic, and it's such an important topic that February 18th, we're going to dedicate an hour of a free content webinar that anyone can sign up for. So please take a look at our Meridian Health Institute's website, Everyday Health Hacker website, to sign up, because it will be a first come, first serve. And it's going to be talking about chronic stress and the toll that it causes in your body, which is chronic inflammation. And here at Meridian, we are a medical dental practice, and in dentistry, we can see 85% of inflammation in the mouth and the gums that is occurring. Number two is that people who are suffering from chronic illness, that small increase of inflammation, whether it's from the anxiety and the trauma of just watching television. So we can see trauma of inflammation from chronic stress hormonally. We can see it from just anxiety, and also just regular pain that a lot of people suffer from, because over 100 million Americans suffer from chronic pain. So this is a very serious problem, and we're going to devote an entire hour to it. So today, for our window into inflammation, what that is a bridge that stays open in the chemical cycle from every cell to the brain, and we've got to turn that volume down. So just like if the television is too loud, you've got to turn that volume down. If you're watching something on television that you don't really like because it's causing anxiety and overwhelm, you got to change the channel. And that's what we're going to be talking about, is changing the channel in our bodies to help decrease that anxiety.
Okay, this is the chronic stress. So chronic stress is just, you've got it every single day and it never goes away?
Chronic stress would be defined as anything that has been occurring for greater than 30 days, 60 days, 90 days. So we can call acute stress anything 90 and above, 90 and below, and we can call chronic anything above 90 days. And that can be something intermittent that comes and goes. So chronic is anything like a headache. A lot of people are suffering from tension, anxiety, and they're grinding their teeth and they're having migraine headaches, or they are having, their jaw is causing them to be painful because they're brexing. So it's learning to turn the volume down so that their body can relax. And one of those relaxation techniques is meditation. Something very simple that we can do at home. 15 minutes of quiet and really listening to your breathing and concentrating on the blessings and the positive and the gratefulness that we have in our bodies and in our life. So to be in 2021, that in itself is a blessing.
Okay, so chronic stress is just when I've seen people have this chronic stressful jobs, period. You just think if you're a healthcare worker, you're anybody in law enforcement or anything else, you can't turn it off. You don't ever turn yours off. You're 24/7. So talk about chronic stress. So the only thing you can do is find a way to deal with it, right?
Well, not only deal with it, but also be honored and grateful with it. So when you're getting a call at 3 o'clock, 4 o'clock, and this is every day, day in, day out, and I know a lot of other healthcare workers that are also going through that, and you have to find the moments to have a stress relief. And some of that stress relief for me is just looking at the trees or looking at the sunset, watching the sunrise, these very simple blessings that we have to remember, that the sun does rise every day, and that in itself is a blessing. So start with a journal. I mean, you'll see me here. If you're watching me on YouTube, you'll see that I'm carrying my new journal for the year. And I like this animal print. It's just something that I really look forward to in starting. And one thing that I teach my patients that are going through chronic stress, chronic pain, is that I only want them to journal what they are grateful for.
Oh.
So it's a different mindset. So instead of stating something that is negative, and everybody has to give themselves permission to put the negativity in a box. If you need to scream for 5 minutes, go to a place where you can do that, let it out, put it in a box, and let it go. If they need to journal and write down things that are negative in their lives, write it down. Don't reread it, crumble it up, and throw it away. Or if you're in a safe place where you can actually have it over a fire, you can burn it too. The key is keep it safe and keep the negativity where you can allow your heart and your mind and your body to go through that negativity, but know that we're going through it and we're walking through it together. Because here at Meridian, we want to partner with your health so that you can come out better on the other side of that. So every time you walk through our door, when you leave us, we want you to be better than when you walked in. And part of that is learning how to be grateful in our journaling, and also letting go of the stress, but accepting that we have stress and letting go of the expectations. I think a lot of us, when we're writing down our goals for the new year's, we set such high expectations and we get disappointed with what we're doing because it's not on our timeline. Well, one of the things that you have to do is actually release that expectation and let the universe provide. If it's in your heart and it's your dream, it's going to happen. Just, it's not maybe necessarily on your timeline. So that's part of the counseling that we do in managing the stress, chronic pain, and development of us as individuals.
You know, you're right. I used to have a guy that worked for me when I had my auto shop, and he had some problems at home, and his wife was ill, and had, you know, money problems and things like that, and it really affected his job. I mean, dramatically. He was a great guy. So I said, look, he'd come in and I said, write it all down, all the problems. He'd write 2 or 3 things down. I said, okay, we folded it up and we stuck it in a little box and we stuck it at the front door. So that's when you walk through the door, leave it right here. And he could get through the day that way. It really made a difference. And eventually he learned how to just deal with it and just chill. Without having to drink or without having to smoke or without having to find some kind of outlet for that. He would just chill out. And it was so much better. He could actually do his job, because sometimes you just got to take a breath and just move on. You know, okay, how do we fix it now? And just managing stress, and it's tough. I mean, I've been in there. I've had cancer and all this, everything else, because of this. And you can just go back to you can just go there and point it out and see it. And so I can see how people are. I mean, right now, this is what a crazy stressful time.
And we want to decrease that anxiety by allowing each person to love themselves. And by loving yourself, that is to let go of the stress. That is to wake up in the morning, be grateful for the breath of life, be grateful for the sun is rising, for your children that are, you know, maybe they're screaming, but you know they're there, and maybe they're making you laugh. Grandchildren as well. And there's just such simple pleasures that 2020 is a nice reflection to get back to the simplicity of what we need to do, because we've all kept our pods. We've kept our family pods, we've kept our friendship pods, because we've had to do that during quarantine. And we're going to keep doing that for a while. And let's do that, and let's build upon it so that we can improve who we are and how we relate with the world.
You know, my next question here was how are we going to, now we have chronic stress, we know what it is, how do we manage it? And you said there, you've already told us all that. But I see a bunch of products here, and I can tell you, folks, this Aloe Cure that I'm looking here right here, that bottle, every night I take a drink of this. I mean, it is, my daughter was over the other day, and we had some Mexican food or something, and she's not your age, Lisa, but she's up there, and so, and she's incredibly healthy, but she has heartburn and a little reflux and things like that. One sip of that, literally, it's not even made it to her stomach yet, and it's gone.
And The beauty about this particular product, AlloCure, is this is the #1 product that I utilize to help people get off of proton pump inhibitors. So a lot of people that have had gastric, whether it's indigestion, whether it's irritable bowel syndrome, this is an autoimmunomodulator. It's a big word. So basically, we carry our stress in our hearts and in our gut and in our hormones. So we have to balance that, and this will help to balance it. So if you do tend to have a little bit of stress and maybe you chose something that you shouldn't have eaten and you did it anyway, this will solve that in about 15 seconds.
Yeah.
So I'm really, really excited to be a part of this particular product. They also have it for those people who are traveling, because a lot of people are starting to travel again, and they have it in capsules, so it's easy to get through in traveling. So both of those are phenomenal, and it balances the acidity of the stomach. And that way people can actually get off of their proton pump inhibitors or their H2 blockers. And you know, what's interesting is that if you are taking those types of medications, get together with your doctor. Those medications are actually only meant by FDA approval to be on for 3 weeks. And all the time I'll have new patients come in and they've been on it for years and years, which decreases their ability to absorb their calcium and their B12, so they become tired, and their bones also become denser, which leads to osteopenia and osteoporosis. So that's a beautiful supplement to help decrease that anxiety and overwhelm that we feel in our stomachs.
Wow, it does a lot. Okay,
Yes.
Now you've got a couple other things here. What's the CBD water?
So this CBD water, for those people who are anxious, they're not sleeping well during this craziness of COVID, this is something that I always encourage. You know, you have to drink your water anyway.
Right.
So why not add it's 10 milligrams of CBD. So it's nice, it's smooth. If you want to flavor it, you can use some of the flavoring electrolytes as well, like Mio. Orange is actually my favorite to place in this one. And I actually like to mix it with this one, which is dragon fruit and elderflower ketones. And what I love about this one is that dragon fruit is, to me, it's like a sweet. So it's kind of like what I would call my mocktail. So this is for if you're anxious in the evening and you're in overwhelm, you might try some decaffeinated elderberry and dragon fruit exogenous ketones, so that when you wake up in the morning, you're not craving carbs or sugar. Your brain is being fed by some good nutrition of your body with the CBD water, which you can find at Water Event, and we'll have that information on our notes for our podcast, as well as on Everyday Health Hacker, where they can order. Actually, with these guys, you can actually order by the phone. They're old-fashioned. They're
cool.
Very old-fashioned.
Old school, I like it.
Old school, I love it. And the exogenous ketones can be found at MCM Nutrition, and you can use the promo code Dr.Liza for a 20% discount. So these are all the little things that we've been doing to help our patients decrease their anxiety and to help them balance their body, their pH, so that they feel better and they can take on that next day.
Awesome, awesome. Now, you know, we were talking earlier, you know, kind of in closing, before we go, I want to ask you, we both made some New Year's resolutions. Would you really mind sharing with some of the stuff we talked about earlier?
So one of the things that we do here at Meridian every year is that we choose one word, and that one word is going to, and a lot of people may have even read the book, The One Word, and that is about taking that one word and utilizing it in everything that we do. And for this year, it's grateful. I am so grateful at all the things that we've been able to accomplish this year. 2020 was different. We came together and we were able to help people. I'm going to say my greatest triumph this year was my 91-year-old patient. She is the first of 4 generations of this family that we got to send home after her diagnosis of COVID and be able to send her home on room air. So that was exciting, and I'm really blessed with that.
Awesome. All right, guys. Thanks, Doc. Hope you have a great week.
Thank you, and we look forward to visiting with everybody. Please subscribe to our podcast platform. Follow us on Everyday Health Hacker, and please leave your comments. We would love to hear from you. Have a blessed day.